Talk about blood pressure measurements. This chart summarizes everything about blood pressure measurements. So whenever a patient comes and asks you to measure his blood pressure, if it gives, let's suppose, less than 90/60, then he is considered hypotensive and his blood pressure is low. Whenever the measurement gives between 90 to 120 over 60 to 80, then it's considered normal. We also have the pre-hypertension stage, in which the patient must look for his health and follow some non-pharmacological measures, such as decreasing the salt intake, exercising, following the DASH diet, stopping the smoking, and many others. We also have the stage 1 hypertension, the stage 2 hypertension, and we also have a severely elevated blood pressure, which is more than 180 over 120, and we usually call it hypertension crisis, in which urgent care is needed. Now, just on a side note, if you measure the blood pressure and it's 20/10 above the goal, then this patient must be initiated on a combination therapy and not a monotherapy. Otherwise, monotherapy is recommended. The most important thing is that you cannot diagnose a patient with hypertension from a single visit. Multiple visits on different days is required in order to be able to diagnose this patient as hypertensive patient. Because as we know, there are several diseases, drugs, and situations that can elevate your blood pressure and not necessarily means that you have hypertension.